As we move through, we've also identified some zip codes, and we're going to call those communities of concern, where the disease burden has really had an impact greater than other areas of our county. And we've today announced that we have a strike force team that's going to be looking at that and looking at ways that they can improve by education, outreach, concern around testing, as well as encouraging our at-risk populations to continue to get treatment for their underlying conditions. As the chairman said, this is not the time to give up on managing your diabetes, your hypertension, your kidney disease. You need to be managing this while preventing transmission of COVID-19. We've also had some indications from our hospital partners. Please don't delay emergency department care. If you have signs and symptoms of a heart attack, asthma, if you have renal disease, if you have signs and symptoms of stroke, please do not delay treatment. Call 911. They are there for emergency services, and they want to bring you in as quickly as possible. And they are able to care for you in both a COVID-positive environment and a COVID-negative environment. But do not delay medical care and treatment. So as the strike force gets together, they're going to really be focusing on prevention education. What can you do in those community areas? How can we help you if you have a positive member in your family or community? How can we help get them the care that they need? Testing, using one of our locations and test, as well as support. We understand that when you're in a household of 6 living in a 2-bedroom, isolating yourself may not be possible. So what can we do to help you support that? As well as referrals. On Saturday, in the pop-up food pantry, over 1,200 households were served with over 62,000 pounds of food being distributed. We know the need is there. So while you're in those community areas and while we look at the increasing infection rate, we want you to know that we're there to support and get you through this. We want you to take care of your chronic medical conditions. We want to make referrals for appropriate financial support and other health care kinds of needs, so that when we come out of COVID, we are not kind of pushing back on our social determinants. We're pushing forward. Again, the reminder